Surendran Chemmenkotil joins us now. Let's connect with him and let's talk about how things have transpired for the quarter gone by. Good morning. Thank you for joining us. Your numbers are indicating that this entire price war, what we saw in the diagnostic space, is getting over. Am I true in assessing that?
Good morning, Nikunj, and good morning to all your viewers. Yes, and the last 1 year or little more than 1 year, we find a little more stability on the pricing platform. We don't find any more disruptions and more sanity prevailing, as you are right.
Uh, so if the price war is getting over and if competition which started with online service providers and with some of your pharma companies which morphed into diagnostic companies and some of the pharmacy companies which were giving diagnostic companies, if that competition is getting diluted, will that translate into better margins and better top line as well?
Well, if you could see in the last 2, 3 quarters, we have been quite stable, and the revenues are at 13 to 15% range, and the margins also showing improvement. If you look at our performance on the margin versus last year at an EBITDA level, we are at about 20, 22% better than the last year. And on a PAT level, we are at about 30% better than the last year. So some of these things are really getting translated into better margins and better performance for us.
Give us a breakup of what is happening to the preventive healthcare business, because that's where the large gains are coming, because Metropolis is adding service after service. I'm going by personal experience that there were services which used to go, we would go to the hospital for them, but now the specialized services are giving at Metropolis. Even though as a customer, I will say they are expensive, but I would also say they're very convenient. What is happening in the preventive healthcare business?
I'm glad to hear that, Nikunj, from you that you are
Focus on
our
the
person.
expensive part also, sir. Focus on the expensive part also. Convenience is great,
Yeah.
but महंगा भी है.
All right. So the True Health portfolio is something definitely doing good for us at 23% year-on-year growth. And now it's turned out to be almost 16, 17% of the total, revenue portfolio for us. The contribution is about 16, 17%. Now, what we have done is, we have one, of course, wellness is a part of the True Health. We've also bundled all the bundled products, even the illness bundles are now part of the True Health. That portfolio is doing well. And about a year back, we have actually curated this whole portfolio for the benefit of the consumer, both from a health advice point of view and also from a commercial point of view. So we are seeing good traction, and particularly the high end, what do you call the high range of the wellness packages are doing well for us. That's one of the reasons why you see the realization is really getting better. It's almost now the True Health packages are at around 23, 2400 rupees per patient. So that really is getting better, and that's helping us to drive the overall revenue.
Right, morning. I wanted to also understand a little bit more about the gross margins. What is the outlook, and do you think we can expect an improvement in your gross margins going down the line?
Well, so we have given estimate of 25, 26 band for this year, and then we are leaving those estimate in the last 2 quarters, and I don't see anything differently happening in the next 2 quarters as well. We will be definitely in this band of 25, 26% for the rest of the year. And going forward, of course, see, we have this strategy of getting into 1000 towns, and for getting into 1000 towns, I think we need a certain number of labs, and those labs will be largely done by the end of this year. So once that's been done, then the focus is about, how do we get more volumes and how do we get more business from these 1000 towns than expanding into beyond 1000 towns. Hence, the lab expansion will go a little slow after this year. And hence, whenever we do lab expansion, it has got an impact of about a percentage, 1.5% EBITDA, for the next 2 years. So once we slow down on the lab expansion from the next year onwards, you will start seeing that getting, translated to better margin for the coming years.
Okay, fair enough. That's good to know. And walk us through the expansion plans as well. How many new towns, new cities are you looking to expand in, and how many labs are you looking to add?
See, if you look at it, the last 4 to 6 quarters, we've done some phenomenal job. We moved in from 300 towns to 700 towns now. The plan is to get into 1000 towns. Maybe in the next 4 to 5 quarters, we must get there. And parallelly, what we're also doing is, we're just trying to make each of these towns more volume-wise and test portfolio-wise and our franchisee-wise getting more and more better and richer. So getting into 1,000 towns is definitely the strategy, the aspiration for the next maybe year and a half. And we have done now about 202, 203 labs already. In the last couple of years, we have added almost 35, 40 labs. And by the end of this year, in this year, we'll be adding another 25 labs. So we may require maybe another 7, 8, or 10 more labs to service these 1,000 towns. So we will get into 25 labs this year and maybe another 8 to 10 labs in the coming year. And we are getting ready for servicing 1,000 towns. That's the current expansion plan that we have.
Appreciate your time. Thank you for joining in and running us through the outlook for Metropolis and what the company is hoping to achieve. So,
if you like this video, then like, share and subscribe to ET Now.